Jellyfish can be found across the tropical world. This jelly-like creature appears to be harmless, but this creature can cause danger to swimmers due to the toxic once in contact with them. In Malaysia, jellyfish are found during certain times of the year, especially in July and September at the beaches. In 2016, the emergency department at Langkawi Hospital conducted a study. They claim that the published data on jellyfish stings in Malaysia are limited, despite the fact that we live in a tropical climate and are surrounded by water. A journal paper published in 2011 recorded that 3 fatalities caused by jellyfish stings on Langkawi Island, Kota Kinabalu, and Pankor Island. 5 incidences of near-fatal envenomation in Langkawi were also described in this publication.
From January 2012 to December 2014, 759 individuals with jellyfish stings were studied, with the highest number of visits in July, October, November, and December. According to statistics, the average age of the patient was 26.7 years. 59.4% of them are men, 68.1% are foreigners, and 40% were stung between 12 p.m. and 7 p.m. At least 90 patients had Irukandji or Irukandji-like symptoms. Chenang Beach had the most recorded incidents with 590 cases recorded, followed by Tengah Beach and Kok Beach. During the research period, the patients were managed symptomatically and there were no fatalities. Based on the guideline for the treatment of jellyfish envenomation in Malaysia, the presentation of box jellyfish, which is Chironex species, are divided into 2. The first one is systemic involvement that can be life-threatening, and the second one is local involvement. Here is the presentation of box jellyfish that can be life-threatening to the victims. For systemic involvement, potentially lethal when more than 10% of total skin area affected. Cardiac arrest may occur within 5 minutes of sting envenoming, hyper or hypotension, tachycardia or arrhythmias, respiratory dysfunction. And for local involvement, presentation are excruciating pain for about 8 hours and delayed hypersensitivity reactions up to 7 to 14 days later.
If you are stung at the beach or in the ocean, the following actions should be taken. First, get out of the water as soon as possible. Second, remove jewelry or any constricting material on the affected limbs. Next, remove the tentacles off with a glove, hands, or tweezers. Pour vinegar on affected area for 30 seconds to inactivate any discharged nematocysts from the jellyfish. Immobilize the affected limb with scarf and do not use firm bandage. Next, get medical help as soon as possible. A box jellyfish sting, on the other hand, can cause cardiac and respiratory arrest, aside from excruciating pain. If life-threatening envenomation with cardiac arrest occur, begin resuscitation immediately. In cases with local involvement, first step is to reassure the patient. Apply ice pack over affected areas to reduce pain. Next, adequate analgesia if needed. And finally, make a serial observation of signs and symptoms.
Most jellyfish stings have no long-term health consequences. Pay close attention when you are stung by a jellyfish and begin to feel dizzy or nauseous. These are the other nematocyst signs of jellyfish stings. First, numbness or tingling, difficulty of breathing, muscle cramps, worsening redness if the sting gets infected, and difficulty swallowing. Finally, whenever you swim in the ocean, you are visiting the natural habitat of jellyfish. There is always the possibility of encountering a jellyfish, but you may take precautions and to reduce your chances of being stung. As a reminder, if you are planning a picnic, diving or any other beach and marine activities, be prepared for any emergency situations.
For prevention and intervention, you can wear proper PPE like a fully covered swimming attire, swim far from jellyfish area, bring more vinegars, and the local authority can have a one-stop shop info about jellyfish stings and prevention at the beach.